How can you avoid false hope from Parkinson's neurodegeneration research? Imagine hearing about a breakthrough that promises to stop Parkinson's disease in its tracks. It sounds exciting, but it's important to stay grounded in what science actually shows. Parkinson's disease is a complex condition where nerve cells in the brain gradually die, leading to movement and non-movement symptoms. Right now, there is no cure, but researchers are working hard to understand it better and find ways to slow or stop its progression. To avoid false hope, start by knowing the difference between what is already available and what is still in the early stages of research. Current treatments mainly focus on managing symptoms, such as using medications like L-Dopa to help with movement issues. These treatments improve quality of life but do not prevent the disease from progressing. On the other hand, scientists are exploring experimental therapies and searching for biological markers that could someday lead to disease-modifying treatments. However, none of these have been proven to stop or reverse Parkinson's yet. Research in neurodegeneration is a slow, step-by-step process. It involves understanding how proteins like alpha-synuclein build up in the brain, how cellular processes fail, and how genetic and environmental factors influence the disease. These are complicated biological puzzles that require years of study, testing, and validation. While promising discoveries are made, such as identifying potential biomarkers or understanding genetic risks, these are early pieces of a much larger puzzle. They are important for future breakthroughs but are not immediate solutions. Be cautious about early findings or preliminary data. Many studies identify potential targets or mechanisms, but these need extensive testing and validation before they can become treatments. Just because a new molecule or pathway looks promising in the lab does not mean it will work in people. Many promising ideas do not translate into effective therapies, so patience and skepticism are wise. Look for evidence from well-designed clinical trials. These are carefully controlled studies that test whether a new treatment is safe and effective in humans. Until a therapy has gone through these rigorous trials and received approval from health authorities, claims that it can cure or modify the disease are unproven. Trustworthy progress is measured by this scientific process, not by early-stage reports or anecdotal stories. Avoid relying on unproven or alternative therapies that lack scientific backing. Some products or treatments may be marketed as cures or miracle solutions, but they often lack credible evidence and can even be harmful. Always consult healthcare professionals and stick to treatments recommended by reputable medical organizations. Stay informed through trusted sources like national health institutes, scientific journals, and reputable research institutions. These sources provide updates on ongoing trials and discoveries, helping you understand what is realistic and what remains uncertain. Remember, the scientific community is committed to progress, but it also recognizes the complexity of neurodegenerative diseases. Maintain hope, but keep it grounded in science. Advances are happening, especially with new tools like advanced imaging, genetics, and biomarker research. These developments are promising but requiring time to turn into practical treatments. It's okay to be optimistic about the future, but always balance hope with a realistic understanding of where the research currently stands. Finally, always work closely with healthcare professionals who understand your individual situation. Parkinson's disease varies from person to person, and treatment plans should be personalized. If you are interested in participating in clinical trials or trying new therapies, discuss these options thoroughly with your doctor. In summary, avoiding false hope means understanding the gradual nature of scientific progress, distinguishing between symptom management and disease modification, critically evaluating new research, and trusting reputable sources and medical guidance. This balanced approach helps you stay hopeful about future breakthroughs while recognizing the current limitations of Parkinson's neurodegeneration research.